Hello and welcome. I'm Dr. Alfred, and today I want to take you on an in-depth journey into an issue that silently affects millions of people over the age of 50. Waking up multiple times at night to urinate, a condition that we call nocturia. Now, many of my patients tell me the same thing when I bring up this topic. They say, "Doctor, isn't it normal to wake up 2 or 3 times at night once you're older?" And while it is common, I want to make something very clear from the very beginning. Common does not mean normal. Nocturia is not just an inconvenience. It is not just a harmless side effect of aging. It is in fact a medical condition that deserves serious attention because of the way it interferes with sleep, health, mood, and quality of life. Think about it. When your sleep is disrupted night after night, your body never fully rests. Your immune system becomes weaker, your heart and brain suffer, and your risk of falls and accidents increases. In fact, research shows that frequent nighttime urination is linked with depression, cardiovascular disease, and even early mortality. So, today we are going to explore this topic thoroughly, step by step. Here's what we'll cover in detail. What nocturia really is and how it differs from other urinary problems, why it happens more often after age 50, the biological, medical, and lifestyle reasons, the serious consequences of ignoring nocturia, practical, science-based strategies you can apply at home, medical treatments, tests, and when you should see a doctor. And I encourage you to stay with me until the very end, because I'll also be sharing some real-life examples from my practice, stories of patients who struggled with this condition and found significant relief once they understood what was happening and made the right changes. So, let's begin. Part 1. Understanding nocturia. At its simplest, nocturia means waking up during the night 1 or more times specifically to urinate. It sounds straightforward, but it's important to distinguish it from 2 other things. First, waking up for other reasons, say because of noise, pain, or insomnia, and then deciding to urinate because you're already awake, is not quite the same. In true nocturia, the urge to urinate is what wakes you up in the first place. Second, some people confuse nocturia with urinary frequency in the daytime. Daytime frequency may be due to an overactive bladder or urinary tract infection, but nocturia is specific to the nighttime hours and has its own distinct causes. Normally, the human body has a clever mechanism to help us sleep through the night without interruptions. A hormone called vasopressin, also known as antidiuretic hormone, signals the kidneys to slow down urine production while we sleep. That's why a healthy young adult can drink water during the day and still go 6 to 8 hours at night without needing the bathroom. But as we age, vasopressin levels decline. The kidneys no longer get the memo to slow down, and as a result, more urine is produced at night. Add to that the changes in bladder function, prostate size, and other medical conditions that accumulate with age, and you begin to see why nocturia is so common after age 50. Part 2. Why does nocturia happen? Now let's break this down into the most common and important causes. I want you to think of nocturia as a puzzle with multiple pieces. Sometimes several of these factors overlap in the same person. 1. Hormonal changes with age. As I just mentioned, the decline of vasopressin is a key factor. Less vasopressin means less concentration of urine at night. So instead of producing a small amount of highly concentrated urine, the kidneys produce a larger volume of diluted urine. We call this nocturnal polyuria. 2. Bladder function declines. With age, the bladder loses some elasticity. Imagine a balloon that has been stretched too many times. It doesn't hold as much air as before. Similarly, the aging bladder holds less urine and triggers the urge to empty more often. In addition, the bladder muscles may weaken so the sensation of urgency comes sooner and is harder to ignore. 3. Prostate enlargement in men. For men, one of the most common culprits is benign prostatic hyperplasia, or BPH. By the age of 60, more than half of men have some degree of prostate enlargement. The enlarged gland presses against the urethra, blocking the flow of urine and preventing the bladder from emptying fully. So even after urination, some urine remains, and within a short time, the urge to go returns, often during the night. 4. Hormonal shifts in women. For women, menopause brings its own challenges. The decline of estrogen leads to thinning of the tissues of the bladder and urethra. This can make them more sensitive and less able to hold urine comfortably. It can also contribute to urgency and leakage, adding another layer to nocturia. 5. Medical conditions. Nocturia is sometimes a symptom of other diseases, and recognizing this connection is vital. Diabetes. High blood sugar increases urine production as the kidneys try to flush out the excess glucose. Heart failure or hypertension. When fluid builds up in the legs during the day, it shifts back into circulation at night when you lie down, leading to increased urine output. Chronic kidney disease. Damaged kidneys lose their ability to concentrate urine. Sleep apnea. This may surprise you, but breathing problems at night cause hormonal changes that increase urine production. Medications. Diuretics, commonly prescribed for blood pressure or heart disease, increase urination. If they're taken in the afternoon or evening, they almost guarantee nighttime bathroom trips. Lifestyle habits. Finally, habits play a huge role. Drinking large amounts of water or tea close to bedtime, consuming caffeine or alcohol in the evening, or eating salty snacks late at night can all worsen nocturia.
Part 3. Why should you take nocturia seriously? Now, you may be thinking, Doctor, is it really that big of a deal? So what if I wake up a couple of times? The answer is yes, it matters a lot. Let's look at why. Sleep disruption. Every time you wake up to urinate, your sleep cycle is interrupted. You lose the deep, restorative stages of sleep that are essential for memory, healing, and energy. Over time, chronic poor sleep leads to fatigue, weakened immunity, and cognitive decline. Risk of falls and injuries. Picture this. It's 2 a.m., the house is dark, you're half asleep, and you're trying to make your way to the bathroom. Many older adults trip on rugs, slip on the floor, or misjudge their steps. Falls at night are one of the leading causes of fractures and hospitalizations in seniors. Mental health impact. Poor sleep has a direct impact on mood and mental health. People with nocturia often feel irritable, anxious, or depressed. They may also withdraw from social activities because they feel constantly tired. Heart and metabolic health. Studies have shown that nocturia is associated with higher risks of hypertension, heart disease, and even stroke. It's not just a symptom. It may also be a warning signal of deeper health issues. Quality of life. Imagine planning your evenings around bathroom trips, dreading bedtime because you know your sleep will be broken. This constant worry erodes quality of life. So yes, nocturia is much more than a harmless annoyance. Part 4. Practical lifestyle solutions. The good news is that there are many things you can do starting today to reduce nocturia. Control fluid intake. Drink enough during the day, but taper off in the evening. Stop fluids 2 to 3 hours before bedtime. Avoid caffeine and alcohol at night. Manage salt intake. High salt makes your body hold on to water. Reducing salt not only lowers blood pressure, but also decreases nighttime urination. Timed voiding. Empty your bladder just before bed. Try the double voiding technique. Urinate once, wait a few minutes, and then go again to make sure the bladder is as empty as possible. Leg elevation. If you notice swelling in your legs, elevate them in the late afternoon for 30 minutes. This helps shift fluid earlier in the day so it doesn't all return to circulation at night. Exercise and weight management. Regular movement helps circulation, hormone balance, and bladder function. Even light exercise makes a difference. Improve sleep habits. Keep your bedroom cool, dark, and quiet. Stick to a regular sleep schedule. Avoid screens right before bed. Part 5. Medical treatments. Sometimes lifestyle changes are not enough. That's where medical treatments come in. Medication adjustments. If you're on diuretics, your doctor may change the timing. Bladder medications. Certain drugs relax bladder muscles and reduce urgency. Prostate treatments for men. Medications or procedures to improve urine flow. Hormone therapy for women. Local estrogen therapy can reduce urinary symptoms. Desmopressin, a synthetic hormone that mimics vasopressin, reducing urine production at night. Treating underlying conditions. Better control of diabetes, heart failure, or sleep apnea can dramatically improve nocturia. Part 7. Patient stories. I want to share a couple of short stories to illustrate the impact of nocturia. One of my patients, Mr. Hitfer, age 67, came to me exhausted. He was waking up 4 or 5 times each night. After some tests, we discovered his blood sugar was poorly controlled. Once we improved his diabetes management, his nighttime trips reduced to just once per night. His energy returned and his mood improved dramatically. Another patient, Mrs. Lisa, age 72, thought her frequent urination was simply aging. But she also had swelling in her ankles. We diagnosed mild heart failure. With proper treatment, not only did her heart function improve, but her nocturia also almost disappeared. These stories show that nocturia is often a symptom with a root cause, and finding that cause can transform someone's life. Part 8. Final thoughts. So let's bring everything together. Nocturia is common after age 50, but it is not normal. It is caused by a mix of hormonal changes, bladder function decline, prostate issues, menopause, medical conditions, medications, and lifestyle habits. Ignoring nocturia is risky. It disrupts sleep, increases falls, and harms both mental and physical health. The good news is that lifestyle changes, such as managing fluids, salt, and exercise, plus medical treatments when needed, can make a big difference. Remember, protecting your sleep is protecting your health. Conclusion. Thank you for joining me for this detailed discussion. If you found this information valuable, please give this video a like, share it with someone you care about, and subscribe for more expert advice on healthy aging. I'm Dr. Alfred, reminding you that a good night's sleep is one of the best medicines we have. Take care of your nights, and your days will thank you.